Good morning. Welcome back here at ESCMID Global TV. My name is Judith Cohen, and I have a full house here in our TV studio in Vienna because I have 5 guests live with me here in the studio. I'll first start out by introducing Robert Read, closest to me. Welcome, Robert. You are here because you brought a team of people, which I will come to later, to talk to me about the clinical grand rounds, of which you are the moderator. Could you, for our viewers who don't know what the clinical grand rounds are, explain a little bit more what it is?
Okay, so it's become quite an integral part of what was ECMID and is now ESCMID Global, and we've done this since 2009, the Prague meeting of ECMID, and the original idea was to give the audience the experience of a live ward round. As they would typically experience in their own hospital, except that the cases are all highly selected for their complexity, difficulty, novelty. The people on the ward round, in other words, the panel at the front, are superb clinicians, internationally well known. Yep. So you put together the combination of young clinicians, typically in training in infectious diseases and clinical microbiology, who present their cases from their country, and the cases are then discussed openly by the panel who don't know the nature of the case in advance.
So they cannot prepare.
So it's completely fresh. And so what this leads to is a really spontaneous exchange of information, and a convincingly real conversation between the consultants, the experts, the fellows, the training doctors, and the audience gets to see that exchange. And the idea is that they learn about the process of taking apart a clinical case of infection and understanding all the possibilities. So it works really well, and the cases are all selected from around the world. They're done by competition. So the young doctors have to write about what their case is. It then gets seen by a panel, and the best ones are selected every year. Yeah.
Does it have to be a case that's already solved by the doctor or the presenter bringing it in?
The best cases are often the ones where it hasn't actually been solved, although obviously it gives the audience a better sense of resolution if at the end you can reveal what the diagnosis is. And usually for an audience member what this means is that they've listened to the case being presented, they've enjoyed the discussion, but they've also formulated in their own mind what they think it is. And so when it's revealed at the end, they're either educated because they were wrong, or they feel a sense of validity because they're understanding infection as well as anybody else in the world. So, it's a valuable process whichever way it goes.
And at the same time, you get an insight in the way experts think.
Exactly. So the audience gets to see a real expert thinking their way through a case, and also very young, vibrant, enthusiastic trainee clinicians who, have prepared the case, and, it's really good to see that vigor and spontaneity and intelligence, on display.
Yeah. So is it difficult to find the experts?
When we first started off, it was very difficult.
Right?
Exactly. It's because, they're putting themselves out there in front of 2,000 people, plus everyone online, and they're at risk of maybe feeling foolish. Yeah. But we try our best not to make it so. No. But they are very brave. When we first started doing it, it was a little bit tricky to find people who were willing to do it. Yeah. But actually, over the years, I think it's become very much more of it's a privilege to be invited, actually. Yeah. Yeah. So we don't have any trouble getting people to say yes now. And usually we draw the consultants from the people who have already been appointed faculty for the ESCMID Global meeting, so that they're here anyway.
Yeah.
So that means that they don't have to travel especially.
Exactly.
And they can make great use of their time.
Yeah. Well, I'd like to just pick the brains of the vibrant young trainee doctors that you brought with you, because sitting next to you we have Seema Sharara. Next to Seema we have Kruti Malur Kumaraswamy. In the back, Jia Aring Lee and Armani Hawes. Welcome. You are 4 of the case presenters. And I would just love to hear from you, Seema, first, maybe. Why did you submit your case?
Yeah, I think it's an incredible opportunity just watching ID Week in the past and ESCMID. Watching the fellows present the case as well as hearing the discussion is always my favorite part of the conference. And it's just been an incredible opportunity to work closely with Dr. Read, to have just the experience presenting in front of a big audience, formulating the case in a clear and direct way. Yeah. And especially we submitted as an ID-SA exchange with ESCMID Global, so I think it's just a great networking and career experience.
Wow. And what was your case about?
My case was kind of a protracted course of a woman who was ultimately diagnosed with trypanosomiasis.
Okay. And did they get it?
They did get it, actually, and it was incredibly impressive because at the time we had no idea.
Yeah.
So a fantastic case and a fantastic discussion.
Well, it sounds like a great educational experience, yeah. And Kruti, how was your case?
I mean, we had a lot of fun, and my case was of an immunosuppressed male with fleeting chest opacities, so lots of differentials, lots of discussion, and the fact that we used a trick test to find out what organism it is, so ultimately ended up being disseminated HSV. So it was fun that way, yeah.
Yeah. So is that something that you keep in mind when you're presenting a case, that you try to make it a little more complex so it'll be more difficult, or people will get sidetracked, or the experts will get sidetracked? Is that something that you work on, or do you really try to keep it as close to as reality as it actually was?
We do try to keep it real, but I think Dr. Read really helps it out in that way, you know.
So do you tweak it?
We do. I mean, obviously, we don't want always the panel to get it straight away, because then the audience doesn't get that sense of tension and surprise. And it's the tension and surprise that enables the education to really strike home. So we do tweak the cases, try and take out all the really obvious bits. I mean, we just to give you a little story. When we were preparing this, we met up a few days ago, and our Italian colleague, a young chap, Lorenzo Bertinelli, he presented a complex case of Whipple's disease.
Yeah.
And it just so happened that as he was presenting, within one slide, Armani, sitting right behind me, said, "This is Whipple's disease." To which we all, I was astonished, of course, because that wasn't supposed to happen. So
Armani
as a
will be in the team of experts next.
Yeah,
well, yes,
exactly.
but as a result, we then had to modify Lorenzo's case, because we learned from Armani that actually there were so many clues there that it could, that an exceptionally gifted person would see it immediately. Yeah. And of course, the people on the panel are exceptionally gifted, and we don't want that penny to drop within 5 seconds of starting the case. We want to keep the tension high.
Yeah.
So we do modify the cases not to catch them out, but just to perhaps make the intrigue last.
To emphasize the learnings that can be taken from it.
Yeah.
So Gia, what did you present?
So I present a case who is a previously fit man, had a lung tumor, and because of the thrombocytopenia, nobody can perform the biopsy of that tumor, mimicking the malignancy, but finally turned out to be candidiasis.
That's surprising.
Well, we were surprised, everyone was surprised, the panel was surprised, the whole world was surprised. So, you know, and well, that's what happens at ESCMID Global.
Yeah.
You know, I don't think I've ever seen a case like it.
No, but if you do,
And nor has
you'll recognize it now. Yeah.
the expert that was discussing the case, Dimitrios Kontianis, he was astonished as well.
Yeah.
Because Jiang gave them the diagnosis. He said, look, the sputum's got Candida in it.
Yeah.
But of course, we normally think that's a red herring.
Yeah.
But it wasn't in this case.
Wow, interesting. Yeah.
Yeah.
And you, Armani?
I presented a case of a critically ill pregnant patient who was ultimately diagnosed with severe strongyloides infection. And the panel got it pretty quickly.
Oh, but to be fair,
Yeah.
I mean, they also, I mean, they discussed the differential, which was nice.
Exactly. And that's what the educational part of it.
And the other thing to mention is, I mean, Armani's from Johns Hopkins. They got it as well. So the infectious disease people at Johns Hopkins also got a clinical diagnosis by the same process that the panel did, which is kind of reassuring that the panel, you know, can do it as well as the Johns Hopkins team can. So,
Well, wonderful. It sounds like a wonderful session again.
It was.
So is it safe to say that this success will be prolonged next year at ESCMID Global 2026?
Well, it's up to the committee, as ever.
Yeah. But if I had to be asking you, you'd be happy to go on for another year.
Well, yes, maybe. Let's see. We'll see what the committee wants. That's up to them.
Yeah. Is there always enough cases being submitted?
Oh, yes.
Yeah. Okay.
Yeah. In fact, we have to be a little bit careful to not solicit too many. What happens is that because it's co-sponsored by Infectious Disease Society of America, we ask IDSA to select cases from the United States, and they send us 6 cases, from which we select 2. And then from ESCMID, we ask the specialist committees to advertise locally for cases, and we usually get around about 40, from which we select 5.
Yeah. And is the quality of the ones that don't get selected, is it really?
Yes, it's always high.
Yeah.
And what happens is that we select them on the basis of mix, how they mix together.
Exactly, yeah.
Yeah.
You want to diverse
how they complement each other.
Yeah. Well, wonderful. Well, thank you all for, organizing such an amazing session, a successful session, and thank you for taking the time and effort for coming here into our ESCMID Global TV studio and telling us a little bit more about the background. Thank you.
Thanks so much.
Thank you all for watching us. We will be back at 12 o'clock when we will be closing this year's ESCMID Global 2025, unfortunately, and we will be doing that with no one less than your program committee, Jacob Moran-Gilad and Julia De Angelis. So tune in with us at 12 for their closing remarks for this year. See you then.